We hear of a mental health crisis, but what is really happening? What's going on with students' mental health?
There's been a lot of data, both national and kind of local, even within UPrep, that is clearly showing an adolescent mental health crisis.
This is showing to be a serious problem.
It's a national problem too. I think that we hear this from our children's hospital colleagues around the whole country. So
It's important to remember that people are feeling differently.
I think some students are doing well. I think people are showing resilience and have lots of protective and supportive factors in their lives. And I also think there are people who are struggling.
And for those struggling, it can be extremely complicated.
I also know that it's not as simple as everybody's just feeling bad. It's more complex than that. And I think the reason for that crisis, it probably has many origins, and I know that it's an area that needs more study.
Mental health expert Kashika Arora finds similarities in comparing the crisis to a natural disaster.
those disasters are worse if your infrastructure was bad before the disaster, right? So a tsunami hits something that's ready for it, it's bad, but it's not devastating, right? Tsunami hit something that wasn't ready, and you have leveled something. And our system was not ready for the wave of need that we are seeing currently. Is you see the community come together after a disaster. And so I think we're seeing some of that around mental health, right? There's a lot of awareness, there's a lot of people talking about it. Some really scary results are probably yet to be seen.
Reporting for uprepmedia.com, I'm Grady Stone.